Jennifer Chapman, and in this short demonstration I wanted to show you all how to give sub-Q fluids to your cat. Our cat was diagnosed a few months ago with chronic renal disease, and this is one of the things that I'm doing to maintain her, and so far so good. She's been a very good patient. Anyway, we are going to give it to her in this bedroom because this is where she feels the most comfortable. Anyway, so I'm going to show you how to put the fluid in the tube on the next clip. Okay, this is the tube that I'm going to be putting the fluids in, and it's a 60 milliliter tube, and I'm sure all veterinarian clinics carry these. And this is a needle that I just put onto the end of this tube, which is a thicker needle, because I'm going to draw out the fluids from this little sac. This is lactated ringers is what this fluid is. So what I'm going to do is I'm just going to, as you can see, this is not the needle you're going to put in your cat. Anyway, I'm kind of getting low on this. I'm hoping I get 60 milliliters out of it, but I think I will. So I just put this in, pull it in, and just draw it out. And it doesn't usually take that long just to pull out. You don't want to have a lot of air on top. So what I'm going to do at the end is I'll just push it up a little bit. Get the air out. Okay, I see I have some air on the top, so I'm just going to push back up a little bit. And I'd say that's about 60 milliliters right there. This not being a completely full, I guess it loses weight and you get more air on the top, but it seems to be fine right now. So I'm going to take this off, and then all you do is put the cap back on and twist it, and it should come right off. Now I'm going to put on the needle that we're going to actually insert into the cat, and it's a little bit thinner of a needle, and you usually twist the bottom off. And I'm going to take this, just attach it on here. So the next step now is just to inject this in the cat. Now some people like to warm it in a microwave or a warm bowl. I suggest warm water in a bowl. I did microwave it once, and I think it got a little bit too warm, and she did not like it. So she doesn't seem to mind room temperature. So this is the way I'll be giving it to her. Okay. Okay, we're now back in the bedroom, and we're going to look for the cat. She should be right by the door here, and I'm going to deposit this fluid into her. Oh yeah, she's usually a good patient. Hopefully she will be for this demonstration. Anyway, Skye, my daughter, is going to help me with this. If you have a second person, it always helps. If you don't, you can still do it. I'm going to let y'all know the reason why it's good to have a second person, because while I'm depositing the fluid, Skye's going to be rubbing her, and she's going to be concentrating more on the rubbing than she will on the needle going in her. So, you ready, Skye? What we have to do is we have to pull a lot of the scruff on her neck and form a tent-like situation, such as this. And I don't know if you can see that well, but and you pull the back of the scruff of the neck, not really on the neck, a little bit below that neck, where you can pull up a lot of loose skin, and you just pull it up, and you just push this in, this tent. Okay, are you ready, Skye? Okay, here we go. Here's our tube with our 60 milliliters of sub-Q fluids. Twist this off, top off. There's our needle. It doesn't have to be in there tight. I'm just going to pull up this scruff in here. I'm going to form this tent here. Skye's going to, and I'm just going to insert this into the cat. She didn't feel a thing. She may have felt it, but she didn't fuss about it. And here it goes. See what Skye's doing? She's just kind of rubbing the top of her neck area, and she's thinking more about that than she is the flutes. Once the needle's in, I don't believe that this is uncomfortable for her at all. See how calm she is? We just happen to be lucky. Not all cats are this way, probably. But she is getting on in her years. She's 18, so she's not the most friskiest cats right now, but she is at times. She has her moments. Okay, that's the end. I'm just going to pull it out gently.
There's a little lump here.
There's a little lump there. I like to massage that lump a little bit. That's only 60 milliliters that I give her twice a week. Some people, give double that amount. She has a little heart murmur, so I can't give her too much fluid at once. But anyway, this makes her feel so good, and I notice that she's not quite as thirsty for the next 2 days. And she feels more fluffed up and more frisky, and it just does wonders for her. I massage it a little bit, and then it goes down in a couple of hours. And now she's going to be very happy. Okay, and I forgot to mention that you cannot use these needles again. Make sure that you safely dispose of them when you're finished. Don't forget to reward your cat. This makes it more fun for them, knowing that they're going to get something afterwards. And these are temptations. You can give her tuna, you can give them anything you want. She is on a restricted diet, kidney diet, so I don't like to give her too many of these. She does deserve a few of them for being such a good patient. So, there you go. See how happy she is now? Thank you very much for viewing our video. Goodbye. I hope this helps.